Welcome back. Time for an installment of Healthy Living. Dr. Taruna Arora is an oncologist and hematologist at Northern Light Cancer Care. Thank you so much for coming in.
Thank you. My pleasure.
September's Blood Cancer Awareness Month, and you're going to talk to us a little bit about some of the latest breakthroughs and things we need to be aware of. Yeah. So let's start with the basics. What exactly are blood cancers?
So blood cancers are basically cancers of blood, bone marrow, and lymphatic system. So these are conditions like leukemia, lymphoma, and multiple myeloma, and they can interfere with the normal body functioning of producing healthy blood cells, which play a very vital role in immunity or oxygen delivery or overall health of our body.
Should people be on the lookout for? What are some signs that you may be suffering from some of these things?
Yeah, so they can be subtle signs, like, for example, persistent like night sweats, unintentional weight loss, loss of appetite. Sometimes it could be persistent fatigue, infections, bleeding, bruising. But more important thing is that all these signs don't always mean cancer. Mm-hmm. So if these signs are persistent or are unexplained or getting worsening over a period of time, which is when it's very important for you to go and see a doctor. And early recognition and evaluation can make a huge difference.
Do all blood cancers need immediate treatment?
That's a great question. The answer is no. So certain blood cancers, they grow very slowly over a period of time. And we usually employ a wait and watch strategy. So we monitor them closely and do not start the treatment right away. But certain cancers can be very aggressive, like acute leukemias. They need immediate treatment. So all in all the cases are pretty different, and we need to individualize the care in general.
So could you put this in perspective for me? How common are blood cancers, and has survival rate changed over time?
Yeah, so blood cancers account for 1 in 10 new cancer diagnoses in the United States. And for example, to put the survival rates into perspective, the childhood leukemias, the survival rates were as low as less than 10% back in 1950s or 60s. But over a period of time, with the recent advancements, they've reached about 80 to 90% in most cases. And in the adult oncology world, which I practice, for example, the survival rates of multiple myeloma, it has more than doubled. So that's incredible. And these dramatic improvements bring in a lot of hope.
You hear a lot about advances in cancer treatment. What are some of the treatments that are available for patients with blood cancer?
Yeah, so some of the recent breakthroughs or the biggest advancements are targeted therapies and immunotherapies. And they're designed to go after the cancer cells more precisely while sparing the healthy cells. Mm-hmm. More exciting ones are the CAR T-cell therapy. What we do is we kind of reprogram patients' immune cells to change body's response to cancer. So these are the recent advancements that have been pretty exciting in our world.
Anything else? Any final thoughts you want to leave the people watching with?
Yeah, I just want to say that blood cancer research overall has made such tremendous advancements in recent times, and the progress in medical field in general is the clearest example of how we need to stay informed and support each other and bring in a lot of better outcomes and a lot of hope for patients and families. And at Northern Light Cancer Care, we are here to help every patient with any blood condition. And in the end, I would say that as a hematologist, I'm always here to educate, advocate for you, and provide the best, highest quality care that I can right here in our backyard.
If you have more questions, it's northernlighthealth.org/cancer care. You see it there at the bottom of your screen. Doc, thank you so much for coming through.
Thanks
a
lot.
Yeah.
Thanks for having me here.
Awesome. Back with more right after this.